a lot of women have tremendous anxiety because of the claustrophobia with an MRI, and then the test results, obviously. There can be differences in our internal vascularity during the menstrual cycle, so that in and of itself can lead to false positives. And finally, women who have pacemakers or other type of equipment, mostly hip replacements can, but pacemaker is the one thing you absolutely can't go into it with. So, can you try? Thank you for working the lights. I just want to show you. This is a picture, and this is actually from our practice. On the left side is a mammogram of a woman who carries a BRCA2 mutation. She had nothing that could be felt, nothing that was seen on this, and you see this small cancer on the right side on the MRI. But you can see even in that incredibly dense breasted, and even it does look very dense on the MRI, you can still see the cancer in that. So that was a very early cancer. Thank you. So when we look at the prospective studies of this, so these are women who have they have followed these women from day one, knowing that they either carry a genetic mutation or that they were likely to carry it. It seems to pick up as high as 100% of cancers. Now, I don't know how you can say 100% sensitivity, because there could be one that you missed and you just don't know it. But it's a very, very high sensitivity for being able to pick up cancer. By the same token, when we look at it, what we're interested in is finding it before we find lymph node involvement. And still, even with our best tools, there's still, in some studies, as high as a 35% chance that we're going to find it with lymph node involvement. So we're continually trying to improve upon that. One of the concerns about this is, are we adequately picking up what we need to see? But you can see, if you have an abnormal MRI, a very large number of them will be cancer. So it is worthwhile doing that test. So in two recent studies that compared mammogram and ultrasound examination with MRI, each of them had more than 500 women. MRI alone even was superior to either mammogram or mammogram and ultrasound examination. And in these two studies, which were just recently published, most of these did not involve the lymph nodes. And so in both of these studies, the conclusion was it's an important screening tool for this population. And I think there'll be no question about that going forward. So what is the goal? Well, the goal is to find a small invasive cancer, such as we see in the middle, less than 2 centimeters with no lymph node involvement. And for that reason, that's what we continue to try to achieve. So what are the guidelines for this now? Well, if you look at annual screening, right now what we see is that anyone who carries a mutation should consider this test and really should get this test. If you're untested but you know that someone in your family has been a BRCA carrier, you definitely should consider this test. And finally, there are different risk models that you can put, that actually some of these you can get on the internet. And some of them were actually done when you sit with a geneticist, but you can figure out your lifetime risk. If your lifetime risk is over 20%, it's worth doing this. I want to just at the very end talk about one project that we're doing looking at it, because I have to talk about sort of our investigational things. This is called a poor person's MRI. It's using contrast but doing a mammogram. And so they have both high energy and low energy that goes into the mammography at the same time, and you use a contrast agent that's more like a CAT scan. Still involves an IV. So when you look at the pictures, go to the next one, this is a mammogram, and the next one, if you look over there, right at the top is a little tiny cancer. And so just like MRI, it subtracted out everything else. And the hope is, since we worry that insurance companies will continue to cut back on who can get an MRI, that by defining this, we may be able to help women who have very dense breasts, who may not have as high a risk, but still need to be screened adequately to get these kinds of tests. So in conclusion, as you guys can imagine, I still think screening is very important. Mammography should still be considered to be the gold standard. If you asked any healthcare professional, I think they would say the American Cancer Society guidelines are what we want to follow, if at all possible. And for higher risk women, we should be thinking not only about mammography, but ultrasound and MRI. And with that, I'll stop. Thank you so much for listening. I hope